and that's exciting that people were interested to hear about the work that we're doing at Brain Health Scotland. So Helen's going to share the presentation for me. So hopefully my slides will appear in a second. But just to start off by introducing myself, I'm Helen Skinner and I'm the National Project Lead for Brain Health Services at Brain Health Scotland. So I'm on secondment there at the moment. I work for Brain Health Scotland 4 days a week. But my substantive post is I'm an Alzheimer's Scotland dementia nurse consultant, and my health board is NHS Fife. So I just had a quick look down the list of people who are attending today. So it's lovely to see some of my colleagues from Fife on the call, but also Poppy that's on the call, who is actually working in our demonstrator brain health site. So I'm going to tell you more about that at the end of the session. So yeah, thank you so much for letting me come along today. What I'm going to do for the presentation is I'm going to start off by giving you an overview of the work of Brain Health Scotland, what we're doing across the Brain Health Scotland team, and then I'm going to move on to talk about the more clinical pathway that we're developing at the moment. And as I've mentioned, we've got our first demonstrator site up in Aberdeen, working with our colleagues in NHS Grampian. So Helen, if you could just move on to the next slide for me. So Brain Health Scotland it's funded by Scottish Government, and Brain Health Scotland was formed in 2020. So we're actually hosted and supported within Alzheimer's Scotland. And as you'll see on the screen there, our kind of mission is to lead on initiatives that will help to reduce the incidence of dementia across Scotland. So Alzheimer's Scotland has 3 strategic drivers, which are prevent, care and cure. So the work of Brain Health Scotland is very much around the prevent part of the Alzheimer's Scotland strategy. So our mission is really to identify risk factors for dementia and help to kind of raise awareness and get public health messaging out there around these risk factors so that we can help to reduce the incidence of dementia in the future. If you could move on to the next slide for me, Helen. That's great. Thank you so much. So the evidence base around risk factors for dementia has really started to increase over kind of the last 10 to 15 years. So there's still much more to learn and to understand around risk factors for dementia. But we now know where we're at a point in kind of the journey where the understanding that we do have around risk factors for dementia is that we can start to put this into clinical practice. So over the last 10 years, we've seen public health bodies release guidance and information around risk factors for dementia. So you'll see on the screen there, the World Health Organization has got a publication, as has Public Health England. But what you'll see on the right of the screen is an image taken from the Lancet Commission report. And this came out in 2020. And it really articulates the risk factors for dementia that run through early life, midlife, and later life. And if you kind of reduce the risk around these, if you introduce kind of measures to really try to eliminate these risk factors in individuals, collectively, we could look at reducing the incidence of dementia by up to 40%. So, you know, that is quite significant. So we're at a stage in the kind of our understanding around risk factors that we need to get kind of understanding out there and incorporate this into kind of clinical practice and clinical care. If you could move to the next slide, Helen, for me. So in September last year, when it was World Alzheimer's Month, the Alzheimer's Disease International, the campaign for Alzheimer's Month was around risk factors for dementia. And they went with the strap line that it's never too early, never too late to reduce your risk of dementia. And this really fits with what we now know around modifiable risk factors in early life, midlife, and later life. So even if you have a neurological condition, it's never too late to look at what risk factors you may have and to help reduce your risk that you might have around that risk factor. So it's really these 12 risk factors and about that importance of highlighting that it's never too early and never too late that is really driving the work of Brain Health Scotland and what we're trying to do. If you could move on to the next slide for me, please, Helen. Thank you. So the slide, the image that you see on the screen here is what we call the brain health pyramid. And this really highlights the tiers of work that Brain Health Scotland is leading on. So you'll see at the bottom of the slide there, the yellow, the public health. So that's work that we're doing really across kind of wide-ranging audiences to just really raise awareness of a brain health and of risk factors in relation to your brain health. And in a second, I'm going to show you some images of some of the work that we've been doing around this. The next level up is target populations. So in relation to this, we're working with particular groups doing outreach work to really get that message across around the risk factors for dementia. And examples of this are target work with groups such as children, but also other target groups such as people who may be are at risk of traumatic brain injury, which is obviously one of the risk factors. So, for example, working with sporting communities. So we've heard of the risk from some elite sports such as rugby and football and the risk to kind of neurological conditions that result from this. So Brain Health Scotland has been working with some of these specific kind of target populations to really get the information out there around brain health. The next tier in the pyramid is the Alzheimer's Scotland dementia resource centres that we have, which have now become brain health and dementia resource centres. So again, I'm going to tell you a bit more about that as we go through the presentation. And then right at the top of the pyramid is the new work that we're developing and testing up in NHS Grampian. And that's the work around developing brain health services. So this is very specific work on an individual level, trying to identify risk factors and early disease detection and working with individuals to develop personalised action plans in relation to prevention. So again, I'm going to tell you more about these as we go through the presentation. But the pyramid there really provides an overview of the work that Brain Health Scotland is doing. So Helen, if you could take me to the next slide. Things that I mentioned, the bottom of the pyramid, trying to do public awareness raising and having campaigns at the general public level. Brain Health Scotland was formed in March 2020, and as you'll probably recall, quite a significant event called the kind of COVID pandemic started in March. So Brain Health Scotland was a new organisation that had just been formed, and then we were hit with the pandemic. So it really curtailed a lot of the work that Brain Health Scotland was able to do. But what they were able to do was some very kind of visual, kind of outward facing kind of public awareness raising. So an example of this is a billboard that was up in Scotland, and don't know whether you've noticed what's in here, your brain your is brain amazing. And as I just did there, your brain automatically corrects that error. Just really showing how amazing your brain is. And then obviously information leading you to Brain Health Scotland and to the website to get further information. So they did that kind of low level public awareness raising, just getting kind of the early information out there about Brain Health Scotland as an organisation. If you could move to the next slide, Helen. Another step that they were able to do is they developed a brain health quiz. And you'll see on the slide there the website link to the brain health quiz. So this is a public-facing quiz that's available on the Brain Health Scotland website. Anyone can access this quiz. And again, this was all developed through the pandemic when the team weren't able to get out and meet people face to face. So whenever I deliver sessions, I like to give people a take-home message or something to do after the session. So from everybody here today, I would love that you go to the Brain Health Scotland website and actually have a look at the quiz and do the quiz. It's a really easy, simple questions that take you through the risk factors for dementia, and it takes you to specific information and advice that can help you around your lifestyle in relation to those risk factors. So if you have got time, please do go and have a look at the Brain Health Scotland website and have a look at the quiz and tell your friends and colleagues about it as well. If you could go to the next slide, please, Helen. As well as kind of doing general public raising awareness and information that was on the Brain Health Scotland website, Brain Health Scotland also developed 2 online learning courses. So these are known as MOOCs, so massive open online courses. And there's two. These are freely available to anyone. You don't have to be a health and social care professional to have to do these e-learning resources. Anyone can access them. So the first one is around understanding brain health, and then the second one is a more specific focus around sport and exercise for brain health. So as I said, both of these are free and freely available. So please, if you're interested in learning more about brain health, then please do access these online learning resources. If you could take me to the next slide, please, Helen. One of the other things that Brain Health Scotland has done, and it really fits with the kind of the theme of it's never too early, never too late. Brain Health Scotland recognised that it's really important to start that education around brain health at a very early age. So Brain Health Scotland have developed the My Amazing Brain resource, and it's called STARS, as you'll see there. And the connection is that there's as many stars, there's many kind of neurons and synapses in the brain as there are stars in the galaxy. So this is a real fun and interactive learning program. It's aimed at children kind of aged between 8 to 12-year-olds, and it really helps them to explore and learn about how to keep your brain healthy. It was recently awarded a highly commended award in the Scottish Charity Awards in 2023. And to date, we've had over 350 schools that have accessed the resource and downloaded the materials and delivered it to well over kind of 15,000 children. So the programme is based on the acronym of STARS, which fits with the kind of the themes of trying to keep your brain healthy, which are connected to the risk factors. So S is about spending time with friends and on hobbies. T is around tucking into a healthy diet. A is around keeping active. R is the importance around rest and relaxation. So as we know, sleep is a risk factor for keeping your brain healthy. And S is around safety, around maybe wearing your helmet when you're on your skateboard or on your scooter. And the programme, it's free for teachers or brownie leaders, kind of cub leaders, etc., to download the resources. They've all been developed in line with the Curriculum for Excellence, so that teachers can take the resource and download the learning materials and deliver it to the children in a classroom setting or a brownie or cub setting. There's all sorts of different resources. So you can download just a short 1 hour session, or you can download an assembly length session, or you can download resources that covers the kind of brain health education program over a number of weeks. So all completely free to download and use with children to really educate them about keeping the brain healthy. Now, we've got a short video just to play, which tells you a little bit more about it, and hopefully this is going to work smoothly for us.
Hi, my name's Sky.
I'm Annam.
And I'm Jamie.
We want to know more about how to keep our brain healthy.
Our brain is found inside our head and is made up of lots of connections between different brain cells.
There are actually as many connections in our brain as stars in the galaxy. Let's think about our brain as being full of stars.
Our brain controls our body moving. It sends messages to our legs to jump or to our arms to give a hug. It helps us understand things that we see, hear, taste, and feel.
And it's where we learn new things and our memories are stored. Our brain is in charge of all these special things, so it's really important that we look after it and keep our stars shining.
S-T-A-R-S, stars. It's a handy way to remember what we need to do to keep our brain healthy.
S is for spending time with friends and on hobbies.
T is for tucking into healthy food.
A is for being active and healthy.
R is for rest and relax.
And finally, S is for safety, keeping our head safe.
We're going to find out a bit more about the things we can do to keep our brain healthy, the stars way.
Your brain is amazing. Let's keep it that way.
Thanks, Helen. Oh, if you can just move to the next slide. Yeah, that's great. So obviously here's some children that have actually taken part and completed the My Amazing Brain program. It's been hugely successful, really well evaluated, great feedback both from children, but also from parents and teachers as well. And quite often, a lot of the feedback is that through the children learning about how to keep your brain healthy, there's an information booklet that the children get that goes home to parents or carers. And so the message is kind of reaching a wider audience as well, because it's not just the kids are getting this information about how to keep your brain healthy. It's passing on to the adult carers of the children as well. So the next steps in relation to this is obviously that program is in relation to kind of 8 to 12-year-olds. It's kind of aimed at that sort of age group. The next step is to look at developing a program more for kind of the teenage age group as well, so that we can get that messaging out there wider as well. So yeah, if you can, that's lovely, Helen, thank you. So again, just with that raising awareness and moving more to kind of that adult audience, you'll see here an inflatable brain. And I think that is I think that's Glasgow Central train station, for those that maybe recognise it. So the Brain Health Scotland team were there doing a promotional event, sharing the resources, telling people about risk factors, about about how to keep your brain healthy. And we've done lots of other events. We've been at sporting events and at various different kind of charity events. We've been at health and wellbeing festivals. So it's really just trying to get that information out there around brain health and how to keep your brain healthy in all sorts of different formats. Next slide, please, Helen. So moving up the pyramid that I showed you earlier, I mentioned about the Alzheimer's Scotland dementia resource centres. So you'll see on the map here, I think it's about 24 or 25 dementia resource centres that we've got across Scotland. All of these resource centres now are in the process of getting rebranded as brain health and dementia resource centres, because Alzheimer's Scotland see brain health and education about brain health a real big part of their prevention part of their strategic aim. So the staff that work in the dementia resource centres across Scotland are being educated around brain health. And every centre has a device where people can come in and undertake the brain health quiz, and they can get information around the risk factors for dementia and information around how to reduce their risk in relation to the various risk factors. So it's really kind of the first step in relation to developing a kind of more clinical pathway in relation to understanding brain health. And again, the great thing about this is that the brain health and dementia resource centres are on the high street, so they're easily accessible for information for people to go in there and get information about how to keep the brain healthy. If you could just take me to the next slide. Yep, that's great. So this was the first centre to be rebranded as a brain health and dementia resource centre. And any of you might recognise this, but this was in Alloa. So as I said, you know, for anybody that is concerned about their brain health or understanding more about risk factors for dementia, they can now come to any one of the Alzheimer's Scotland resource centres to have a discussion with a member of staff there. They can undertake the brain health quiz and get information and advice. And everybody that comes through the centres are given information about the Neuroprogressive and Dementia Network and the Joint Dementia Research Network as well. So all the staff working in the centres have been trained to have conversations with people using the centres about the importance of research and being able to sign up to research as well. Okay, if you could take me to the next slide. So I'm now going to kind of spend just the next kind of part of the session just really telling you more about the development work that we're doing around brain health, the development of brain health services. And this is the bit right at the top of the pyramid that I mentioned from the brain health pyramid. So this is developing a clinical pathway that will really provide a service to people to really understand how to keep your brain healthy, but also to understand the risk factors and really that early detection of disease for people. And it's really done in that anybody coming through the brain health service will have that personalised action plan, that personalised information, support and resources to help and support them around the particular risk factors if they have any. So it's really kind of shifting the focus, moving it away from diagnosing dementia at a later stage in the disease, when symptoms are maybe presenting, to moving and really looking much earlier in the trajectory at kind of that pre-dementia stage. So really shifting the focus to the prevention and what we can do to keep our brains healthy. So if you could just move to the next slide, Helen, thank you. So The new clinical pathway is based on work done by Professor Craig Ritchie, and you'll see all the co-authors of the kind of main article around this on the screen there. But it's based on the Scottish Brain Health Service model. So this paper was published in 2021, outlining a model for a brain health service. Now, there are other brain health clinics down in England, so Oxford, Manchester, I think there's one in Belfast as well. So other places have got brain health services and brain health clinics, but they tend to be very much connected to research sites. So where there's maybe studies taking place in relation to some of the new medications that are coming out and being tested. Whereas the Scottish model is very much based on that open access for people, so not connected to any research studies per se. So from the Scottish model, Brain Health Scotland have developed a set of recommendations for clinical practice based on the Scottish model, really outlining how to develop a brain health service and a brain health clinic. Helen, if you could move to the next slide for me. So I mentioned at the start about a demonstrator site for developing a brain health service. So Brain Health Scotland is currently working with the public health team in NHS Grampian to develop the first brain health service and brain health clinic, which is truly open access, and it's the first in the UK to do this. It's based in the Brain Health and Dementia Resource Centre, which is on King Street in Aberdeen. So it's literally right in the centre of Aberdeen, and it's open to everybody. You don't need to be referred by a GP or by a primary care practitioner. Anybody can access this new Brain Health and Dementia Resource Centre and have a conversation about their brain health. Helen, if you could just pass on to the next slide. This is a photograph of the team that is working in the Brain Health Centre, and Poppy, who's second from the left there, is on the call today. But we have Poppy, who's the clinical nurse specialist for brain health. We've got Dr. Tom McEwen, who's a consultant psychiatrist. On the right is Karen Black, and she's the centre manager. So she's an Alzheimer's Scotland member of staff who works in the Brain Health and Dementia Resource Centre. And Rita on the left is the administrator for the service. So the service was just launched on the 4th of December last year, so it's very new, and it is a demonstrator site. So we are testing this to see how it works in practice. Helen, if you could move to the next slide for me. So the demonstrator site, again, it's a multi-agency project, so it's funded by Scottish Government. And as I said, we're working with the NHS Grampian Public Health team, with the Alzheimer's Scotland team in Aberdeen, and obviously Brain Health Scotland is supporting this work. As I said, the unique thing about this brain health service and brain health clinic is the option for people to self-refer and just to walk into the service. So the slide on the screen now, it's a little bit busy, but I just thought it's maybe useful just to give you an overview of the service and how it works. So there's two different routes that you can come into the service. I'll start with the one on the bottom left. So somebody can access the service by literally walking in off the street and coming into the Brain Health and Dementia Resource Centre. And there they'll be met by Karen, who's a centre manager working in the centre, and she will undertake a brain health questionnaire with that individual, where it will complete a lifestyle assessment in relation to the risk factors for brain health. And from that, the individual maybe be given information and advice around a particular risk factor if they experience one. And it might be that they'll be referred to other services. So, for example, smoking is a risk factor. And if that individual is a smoker and they express a desire to try and stop smoking, Karen has information and resources available to give to that individual about how to stop smoking, but she'll also be able to direct that individual to the smoking cessation services in Aberdeen. The second point on that is that up in Aberdeen, they have a service called Health Point, which is a telephone service where individuals can ring up and get information, advice, ask questions about kind of health related issues. So the Health Point team also can take phone calls from members of the public. So if people can't actually access the Brain Health and Dementia Resource Centre, they can contact the Health Point telephone line, and the Health Point advisors will also work through the brain health questionnaire with those individuals and will go through the different risk factors, and again can signpost them to information and advice and make onward referrals to other services that might support them. At this stage, again, everybody will be invited to join the Joint Dementia Research Network or asked if they would like to join the Neuroprogressive Dementia Permission to Contact scheme as well. If somebody through either Health Point or through the centre manager in the resource centre identifies several risk factors for dementia, or if they express concerns about their memory or about their brain health, they will be invited to go through to the next stage of the service, and that is through to stage 2, which is the Brain Health Clinic, which is where Poppy, the clinical nurse specialist, works, and Tom McEwen, the psychiatrist, work. So this Brain Health Clinic isn't away in an NHS premises anywhere. It's actually in the Brain Health and Dementia Resource Centre in King Street in Aberdeen. So it's like almost like a one-stop shop that people can come to one place to get that assessment and to get that information and that advice. The second route into the service is through GP referrals. So if people do present at the GP, maybe with concerns about their cognition or worried about their memory, but on cognitive assessment, score quite highly, a GP will be able to refer an individual into the Brain Health Clinic to get more detailed assessment. So 2 different routes, either just a self-referral system or via a GP is the 2 ways that people can access the Brain Health Clinic. So if somebody does come through to the Brain Health Clinic, when they see Poppy, the nurse, Poppy will do more detailed assessment with that individual. So she'll do more detailed cognitive assessment. She'll do kind of a functional assessment around lifestyle. She'll do things like blood pressure, temperature, pulse. She may also do blood tests. The people will also complete an assessment around sleep, obviously one of the risk factors, and also a depression and anxiety assessment as well. So, and then depending on what the outcome of those assessments are, it might be that no further action is required, and Poppy will kind of go over the personalised action plan that has been given to the individual by seeing either the Health Point advisor or through the centre manager, or it might be that she gives more specific information and advice depending on what things were found through the more detailed assessment. If there are concerns or kind of abnormal results through any of the assessments that Poppy the nurse has done, then they will move on to be assessed by Tom, who's a psychiatrist working in the service. Now, it might be at this stage that neuroimaging, maybe kind of MRI scans might be required. It could be potentially that they might get referred to have a lumbar puncture done, to have CSF sampling done. or it could be that they refer to neurogenetics for further screening as well. At this stage, blood-based biomarkers aren't available in the UK, but Brain Health Scotland has been doing some work with the Davos Alzheimer Collaborative, and in NHS Dumfries and Galloway, we've been doing some testing around blood-based biomarkers. And there's a lot coming out in the news. There's been a lot in the news just recently about increasing the availability of blood-based biomarkers. And Alzheimer's Research UK have just been awarded a £5 million grant to do work around increasing the availability of blood-based biomarker testing. So this might be something in the future that we can look to incorporate within the Brain Health Clinic up in Aberdeen. If anybody is suspected of having a potential diagnosis of dementia, they will be referred to the normal memory clinic route as what would be the normal kind of pathway within NHS Grampian. So after the patient has maybe seen the nurse or seen the psychiatrist, both Poppy and Tom have the capacity to bring that individual back for review at a later date. Again, at every stage, they'll be invited to join the neuroprogressive and dementia network or join dementia research. And obviously through joining those, it might be that they can be matched to suitable research trials that are taking place across Scotland and the UK. So really the point of the Brain Health service and the Brain Health Clinic is to provide kind of that assessment around risk factors for keeping your brain healthy and help to provide that information and that advice and support for individuals around how to reduce their risk of dementia and how to keep their brain healthy. So it's a very personalised approach on a one-to-one basis, providing information for individuals. If you could move to the next slide, Helen, for me. So as I said, the service has just gone live just last month, or no, we're February now, so just in December there. And already we've got individuals starting to come through the service, both through Karen, the centre manager, and Poppy and Tom have seen patients in the Brain Health Clinic as well. We're just currently now heavily promoting the service, letting GPs know about the availability of the service, but also getting out into Aberdeen, letting the public know about the availability of the service, what it's there for, what it can offer, how it can help individuals. So we've got supporting information leaflets, and we just had our communication and engagement meeting this morning, and there's shortly going to be a social media campaign. There is a website, NHS Grampian have a website for it. There's going to be information on buses. There's already been posters and flyers gone out to various public spaces. So obviously, the more we can let people know about this new service, the more that we can get people involved in it, and we can help to support people to keep their brains healthy and reduce the risk of developing dementia in the future. And if you could just go on to the next slide for me, Helen. So obviously, as I said at the start, all of this work around brain health is kind of new. It's a developing field of evidence around it. And Brain Health Scotland is doing loads of work around developing new things. We just met yesterday, and we're going to be developing a brain health awareness session. And we're going to be developing a brain health education programme that people can access if they're concerned about the brain health. So we're really keen to work with people to develop a lived experience panel around brain health. So we're looking for people who might be interested in brain health, or actually maybe concerned about their own brain health. And we'd like to invite you people to join our lived experience panel. So if there's anybody on the call today who wants to learn more about the work of Brain Health Scotland and help and support us in developing kind of materials and resources, and you're maybe interested in brain health or maybe concerned about your brain health, then we're really keen and excited to hear from you. So you can either get in contact with Helen, and she can take your details to share with me, or I'm happy for you to contact me directly on the email address, on my email address on the slide there as well. And I think if you just take me to the last slide, I think that's me. So I know that's a lot of information that I've kind of rushed through there quite quickly, but I wanted to allow a little bit of time for questions there at the end. So more than happy to take any questions. If I'll hand back to Rosie.
Thank you very much, Helen. That was really interesting. We have one question already in the chat, and then if anyone else wants to either raise their hand or put questions in the chat, that's fine. But the first question we had was whether there were any risks, or I suppose different risks, around the Black and ethnic minority communities.
Yeah, no, so there's nothing specifically identified in the literature directly to say people are more at risk to do with their brain health, but we know some of the risk factors are more prevalent in certain individuals. So for example, diabetes, something like that. So nothing in particular around the Black and ethnic minority communities, but we do know some of the risk factors might be more prevalent. So some of the work that we want to do is to reach kind of target audiences. So some of all the materials that we're developing for the resources for the service up in Aberdeen are being translated into various different languages, so they're accessible. We also have interpreter services, available as well. So yeah, and some of our target audiences might be the kind of more hard to reach audiences. So people live in maybe more socially deprived areas, lower income kind of areas as well. So we know that they are the areas that we need to target and aim our resources at, so we can reach everybody who we can help going forward.
Thank you. And I know we've got a couple of hands up, but I know it's okay. I thought the person who asked the question had put their hand up, but I think they put it down again. So I will move on to David. You've got your hand up.
Yeah, thanks, Rosie. Helen, I just wanted to ask that if someone pops into one of the centres and is not seen to be at high risk at this point in time, but maybe very, very low risk,
Yeah.
Would that visit be recorded on their national health record?
No.
So their GP is aware of it.
Yeah, no. So if you just come into the Alzheimer's Scotland Brain Health and Dementia Resource Centre, or if you contact HealthPoint, that's not recorded in any NHS system at all. But if you were to be referred into the Brain Health Clinic, it's only at that point you become a patient, and then it is recorded in your healthcare record. So up until that point, you're just getting information and advice. Are you thinking in relation to kind of concerns around life assurance and things like that, or
No, it's just I was thinking about maybe a GP follow-up with the individual later if they didn't show up again. That's all.
Yeah. So the HealthPoint, through the HealthPoint, or through the Alzheimer's Scotland Centre, that's just a direct contact, and it's not communicated anywhere else. But as soon as you become a patient in the clinic, then the GP will be informed of it. Yes.
Okay, that's fine.
Yeah. Thank you. And we've got another hand up. I think the name I can see is Stuart Nicholson. Is that right? Oh, you just muted though.
Oh, he's still on mute.
Still on mute, I'm afraid.
Sorry, that's my son's name. Apologies, I can't get rid of him.
No problem at all.
I'm Linda Nicholson. Nice to see you again, Helen.
Yes, hi Linda.
Hiya. So I was just thinking, right, obviously it's well known that a major risk factor for dementia and indeed other health conditions is older age. But by, this is like a very visible, open approach. And I just wondered if that's particularly geared to younger people as well. I know you've got stars, but I just wondered if that was because there's an increase in younger people with dementia. Is that reflective of current demographics?
Yeah, no, not particularly, Linda. I think the messaging, the work that Brain Health Scotland are doing, we target it at any age. So, I guess it goes back to a little bit to that. It's never too early, it's never too late. We all need to keep our brains healthy, and I think I say this quite a lot when I'm doing presentations and I'm teaching. When I was a student nurse, I did a module on health promotion, health education, and we looked at the heart and the lungs and the liver and that's smoking and drinking and things. We never once talked about the brain and keeping the brain healthy. And I went on to be a neurological nurse. I worked in neuromedicine and neurosurgery. So I know I'm a little bit biased, but I do think the brain is the most important organ in the body because it controls everything else that is happening to you. And now, when you look back, you think, God, why didn't we think about brain health then? Why were we so focused on your heart and your lungs? And I know your heart and your lungs and everything are all really important as well. But why did we neglect the one of the main organs in your body? We just didn't think about it. So I think it's like we're catching up and we've suddenly realized actually we do need to keep our brains healthy. So what we're trying to do is at any age, really. And if we want to keep our brain healthy for a whole variety of reasons, and not just because of dementia or other neurological conditions, but obviously a lot of this work that Brain Health Scotland is doing has borne out of dementia and kind of identifying dementia. And we know that, changes in the brain in relation to dementia start much earlier than when the symptoms start to present. So we need to target now we do know there are risk factors for dementia. We need to target them before the damage by that risk is done. So that never too early, never too late. It's never too late to improve your brain health. I know I've personally got risk factors now, and I still class myself as midlife, hopefully. So it's any age, and I think it's important at any age, no matter what conditions we all might be living with, that we think about our brain health. And doing it with children is they're learning about it in a fun interactive way that it's I guess a lot of the risk factors overlap with cardiovascular risk factors, so they're good for lots of reasons, but they're learning how to keep their brains healthy at a really young age that will then hopefully will go through that lifetime. So I think for me as a nurse, maybe coming towards the end of my career, I might not see the huge impact of all the work that we're doing now, but I hope my children and maybe my children's children is that brain disease might reduce in the future because we know much more about how to keep our brains healthy. I hope that answers your question. I've waffled a bit there.
No, you didn't waffle. No, thank you. That's interesting. Thanks.
So we've just got one more question and then I will do a bit of a wrap up, and that's in the chat, and it says there are a lot of these risk factors in offending populations and that there's been a big call for dementia research in prisons at the moment. Are there any resources for criminal justice staff who may have contact with individuals at risk of dementia in secure environments?
Yeah, that's really interesting, and actually that's quite exciting as well, isn't it? At the moment, we've not done any work in prisons at all, but I do know through my NHS job, I've had contact. Perth prison is very near, and we've had contact with the prison about individuals who have been diagnosed with dementia whilst in custody. So I think it's something really important, and you've just probably added something to my to-do list. So I can't see who's Bethany. I don't know whether, Bethany, you could drop me an email maybe, because it might be really good to connect on that and see, does Bethany work in the field of prison work? But I think it'd be something exciting that we should explore, and maybe another target audience that we've not really thought about. But love to hear from you, Bethany, to explore that in more detail.
I've realised there's another question that's snuck in there, so we'll see if we can get that one in as well. Where it says there's an increasing recognition for the experience of dementia in younger adults. Some may experience symptoms other than poor memory. I'm wondering about the resources and information available to people highlighting symptoms such as visual disruption, visual and perceptual deficits, early language changes, etc., to improve early identification of dementia in individuals experiencing these symptoms. There are large delays in diagnosis, etc., as a result of a misunderstanding of common symptoms associated with dementia.
Yeah,
Does that all make sense?
Yeah, well, I'm not quite sure, but I guess it's that understanding, isn't it? Increasing knowledge and understanding of, symptoms of dementia and things sometimes being misdiagnosed as well, which, we know frequently happens. So I guess, as I've said, this is such a growing field, and we're now understanding much more about the risk factors. And, there's new evidence coming out all the time about risk factors for dementia. So the 12 risk factors that are identified in the Lancet Commission report, we know there's probably 2 additional risk factors. So the sleep risk factor isn't identified on the Lancet Commission report, but there's increasing evidence coming out around that. The one that always surprises people is hearing loss being a risk factor. In fact, it's one of the big, well, it's uncorrected hearing loss is the biggest risk factor. But I know this query is particularly in relation to visual problems, and again, we know there can be lots of changes in visual things for people with dementia. So I think it's having that greater understanding, and the evidence base is updating all the time. We have a research officer who works in the Brain Health Scotland team, who part of her role is constantly looking at new evidence. So the visual things is definitely something to be included there. We were together as a team yesterday, and we were discussing about vaping, because there's been quite a bit in the news, hasn't it, that the banning disposable vapes. And what is the risk around vaping and in relation to your brain health, and in particular, the vaping is very much a teenage young adult, where it's becoming quite a problem, and your brain is still developing at that stage. So what damage is it doing to your brain and things. So yeah, new emerging evidence all the time, and it's moving at quite fast pace to kind of keep up with it all. But yeah, no, definitely, I think the more we can do to educate the public around the risk factors, but also health professionals. In my NHS role, I've spoken to a lot of staff about brain health, and even very experienced doctors have said to me, "Oh my God, I didn't actually realise that that was a risk factor." So yeah, lots to keep abreast of. And I've seen Bethany's reply there. Yeah,
so thank you very much, Helen. It's been really helpful to have you come along and talk, and it's great that so many people were able to come and listen, and we have also recorded this, so it will be available online. Just to say, we have our next webinar on the 29th of February, 2 till 3, and that's going to be one from Dr. Victoria Shepherd, who's talking about advanced research planning, particularly in the context of care homes and people whose capacity may change. So you can sign up for that. All the details are on social media and all those things, or you can contact us directly. But yeah, just a huge thank you, Helen, for answering all our questions and for sharing that information. And if anyone has any questions that they've not been able to ask today, or they think of afterwards, either get in touch with us and we can pass the question on, or you can contact Helen directly. But thank you very much for joining us.
Thank you. And if anybody wants to